Hello everybody, it's Dr. Al. I miss seeing all of you. It's been just over a month now that we've had our patients here at Alligator Dental, and we miss seeing all your smiling faces. I'm making this video today for some important information. In the last month, while everyone's been at home, we've actually, to be honest, stayed pretty busy here at Alligator Dental. In fact, just in the last 3 weeks, we've seen over 100 emergencies at Alligator Dental with kids in pain or have real problems. It's made me realize that during this time with kids at home, there's a lot of things going on. Kids doing crazy things, parents may be a little more attentive and seeing what's going on in their kids' mouths. And so we want to make this video today because there's been two things I've heard from a lot of people. First off, I've heard people, they reach out to me, they said, my kid was in pain for a while, I wasn't sure if I called, it kept getting kind of worse and worse until finally we just had to call. So that's the first thing I've heard. The second thing I've heard is, I was just looking at my kid's mouth this morning, been a long time since I looked, and I saw this. And then they reached out to me. So first off, if your kid's in pain or having trouble in some way, please let us know. There's no reason for a child to be in pain. And under the current circumstances, we can make a difference. We can help so your child doesn't have to be in a bad situation for a while. Secondly, take a look in your kids' mouths. And today we're going to talk for a few minutes about how to do a simple oral screening for your child, some tips and some tricks so you can go home and do it today and hopefully be able to catch any warning signs or identify some things before it turns into a bad situation. So let's talk about that. So a simple dental screening that you can do at home is very simple. You need three basic things. First off, you want to be in a room with good lighting. Here we picked a room here in the office where there's good light coming in through the windows. The more light, the better, all right? The second thing is you want to be able to get your child into a good position. And so what we've done is we've just set up 3 chairs in a row with a pillow. You want your child to be in a laying position. That is the simplest way to be able to get a good look at your kiddo's mouth and be able to look inside. And then the third thing that you're going to need, basically, clean hands. If you don't have gloves at home, that's okay. Washing your hands very, very well is a good way to keep things clean while you're taking a little look around. And you're not going to be way far inside, but just using to move lips or maybe open mouths a little bit is enough to be able to get a good look at things. So that's what we're going to do here in a few minutes. Again, lighting, good place for your child to get kind of laid down so you can get a good look at actions, and then clean hands. Now that you've done the 3 things to get things all set up, let's talk about a couple things you can do to do your actual screening, what to kind of be watching for. So here I've got my daughter Miley who's volunteered to come lay down and show off. So I've got gloves on here. I've the luxury of having the signature Dr. Al orange gloves. But let's talk about the screening. So all you're doing is looking for trouble, looking for problems, all right? Your kid's in this laid down position, and the most handy dandy thing I recommend you now have available is just your cell phone. Make sure you get your flashlight. You want to have good lighting again. And you're going to take your flashlight, turn it on, and just by having your child open, say, ah. Kind of move the lip out of the way, look around, kind of sweep under the lips, around to the side. You can get a really good look all the way on your child's bottom teeth. Then shift positions, come more to their side, and have them do the same thing on top. Open again. You're going to stretch way back there, and you're going to look around. And the areas you're really watching for is along the gum lines, up under the lips. And if you see a tooth that's got any concern, do a little push on it, see if it's got any wiggle to it, and you can look around. And as you're doing this, you can take all the pictures you want. What you want to do is, if you are going to take a picture, take the picture so it's in focus and as close as possible. You'll be surprised how close you can zoom in and how close you can get a look at a tooth or a spot or whatever it is, okay? And really, there are 3 primary things you're looking for. 1, we're looking for signs of abscess or a possible infection. Almost anytime you have an abscess tooth, you're also going to see probably a loose tooth. So if you see a little bump on the gums, as you can see in our picture that we'll be showing, you also want to check to see if there's got any looseness to it. And really you're looking to see if there's a tooth that's falling out, or is there a possible infection going on. Number 2, you're looking for any signs of cavities or troubles. What you'll see on those areas, you'll probably see like a broken tooth or a piece broken on the tooth or a dark spot or something like that. That's the other thing you're really going to be watching for. And then third of all, anything else that might be of any alarm or concern to you that doesn't seem normal, doesn't seem natural, all right? Take pictures of it and we will be happy to take a look at it. You can send it our way. So let's do a little wrap up now. As a recap then, for your little screening at home, once you've got things looked at and got some pictures, look over them, kind of peruse through them and make sure there's anything that has you worried at all. Again, looking for dark spots, broken teeth, loose teeth, swelling on the gums, maybe even some bleeding. Things like that will help you get an idea if there's any problems going on in your kid's mouth.